And I'd like to talk to you about the impact on our staff and our services. We are starting to begin to have a surge. We are lucky we're following behind some of the other hospitals in the state. Our neighbors to the west of us, Medford, with the Asante system, they have 85 inpatients at this point. We only have 9 patients at our most recent check. But just a couple weeks ago, we had 2 patients, and that's now slowly increasing. At our peaks back in December and again in May, we would have up to 20 to 25 patients in the hospital. Our modeling is actually predicting to have 25 to 30 patients. We are about an 80 to 90 bed hospital here, so that's up to a third of our patients will become COVID. And we also had a very busy summer. Our census has been at full capacity throughout the summer with just the normal medical illnesses that occur. And part of this is because people didn't get adequate care or follow-up last year because of the COVID and not going to their physicians. So the impact on the hospitals, we've been working very, very hard. We have nursing staff, physicians as well, that have not taken vacations for a year to year and a half now. And just as we thought things were settling down, they're starting to build up again. And then in our hospital, we're starting to see younger and sicker patients. On our current census, we have a 23-year-old who just delivered. She's on high-flow oxygen. We have a similar case with a 29-year-old woman who also just delivered. We have 3 to 4 40-year-old women, and then we have some 55, 60-year-old men, plus a 78-year-old woman. So we a year ago, we never saw these younger people in the hospital. So this is a new something new for us. And the frustrating thing is, talking to one of these patients, is as a physician, we're very limited on what we can do. Almost all of the patients I treat with COVID say, can I get the vaccine? And by the time you're in the hospital and critically ill, no, it doesn't work like that. And all of them say, if I'd known about this or how I felt or the effect on my family, I would have got the vaccine. What as a physician, what we can do is we really support you. We do have some medications, but they're minimally effective. Remdesivir, some dexamethasone, a steroid. We've got some monoclonal antibodies that we give patients. But these really, they do work somewhat, but they're not. As a patient told me yesterday who's on high-flow oxygen, said, can you give me something to make me feel better? No, we're just supporting you and trying to help you breathe the best as possible. So it's a very frustrating illness for both physicians and nursing to care for, and to watch these people go on and get progressively sick in some cases. We've had one person that a couple weeks ago went out and got a lung transplant from Stanford. We have a second person now that's being evaluated for lung transplant. When I talk about the patients, like 9 or 10 that are currently in the hospital, that's acute infection. That's not talking about the 4 or 5 that have been here for 20 plus days who are no longer infected, but still need such amounts of high-flow oxygen, we're unable to send them home. So the key to all of this is to get vaccinated. If we all were vaccinated, this would shut down the spread of the virus, shut down the mutations and the variants that are occurring. And we're talking about lives here, and I can't emphasize enough the importance of the vaccinations. And that's it. I'll turn it over to Dr. Robert Turngren at this point. Thank you.
Thank you, Dr. Niskanen. At Samaritan, we have 5 hospitals in the Willamette Valley, in Lynn, Lincoln, and Benton County. And currently, our hospitals are quite full. Our staffing is a challenge. We are full with non-COVID patients, and we are also at our historic high water mark for COVID inpatients at 25. As of yesterday, all 25 of our COVID positive inpatients were unvaccinated individuals. Our percentage of unvaccinated inpatients never drops below 95%. These patients are younger, as Dr. Niskanen pointed out, and they are somewhat sicker than the groups that we saw in the surges earlier this year and last year. I think that, if you understand the science of viruses, virology, the virus will continue to mutate and continue to spread unless steps are taken to stop the virus at its root, and that is through vaccination, plain and simple. The public health measures of social distancing and masking are all very important to keep our population as safe as possible, keep our numbers low. Everyone remembers bend the curve, but those are mitigation strategies. Those are not success strategies. The vaccination is the success strategy. And I have family, just like all of you, and my advice to them and my advice to patients, my advice to our communities is if you're on the fence about vaccination, you've not been vaccinated, this is a wonderful time to jump off the fence and get vaccinated. The vaccines are available throughout Oregon. They are effective. And the immune response, which we often call the side effects, are for the most part minimal. And for those that are a little more aggravating, they are short-lived. So these are all very safe vaccines and very effective vaccines. Thank you. I'd like to turn it back over to Rob now.
Thank you, Dr. Turngren. And with that, we'll start with questions. And I think the first question is from Ivy Green with the Oregonian.
Thank you. I have two questions. My first is, this report seems unusual to me because Oregon has decided to report breakthrough cases as well as hospitalizations and deaths, which the CDC only asks for those last two pieces of information. Can you describe to me how you think this fits in? I mean, have you heard other reports from other parts of the country about the percentage of breakthrough cases?
I'll take that question. Thank you. So it's true that Oregon Health Authority has definitely gone above and beyond what the CDC has asked for. Very early in the year, CDC asked for all vaccine breakthrough cases to be reported. And then they quickly restricted that to hospitalizations and deaths, I think because there were just too many vaccine breakthrough cases that were not severe, and that's again to be expected. In Oregon, there was intense interest in these data, and so we have continued to report it out. I'm honestly not certain what other jurisdictions are doing. I would be shocked if there weren't at least some that are reporting all data, but I'm not certain.
Okay. My second question is, do you have percentages on breakthrough cases by the type of vaccine? Pfizer, Moderna, J&J. Particularly, I'm interested in seeing if J&J has more breakthrough cases, and if you don't have that data to share, why not? That seems like really relevant information.
Yeah, thanks, Jaime. We haven't made that information public yet, and a large part of that is simply capacity. We were not staffed or prepared for this volume of vaccine breakthrough work. So I think it's something that we could look into providing in the future. I know there's interest in it. It's just a matter of parsing the data. Unfortunately, each one of these cases does require manual review because the quality of information that's put into the vaccine database is not always such that we can automate the process.
How about, can you give me an idea with J&J? It seems like the study statistics show that it's less effective at preventing severe consequences or death than the other two vaccines. Have you seen that reflected in the numbers?
That's a good question. I would say that we've definitely seen that in our hospitalization surveillance data, and that's what I'm most familiar with. So I haven't looked at the non-severe cases in the community, but the clinical clinical trial data was pretty clear that Johnson & Johnson, while still very effective, was less effective than Pfizer and Moderna. And we have seen that. And that's the data that was released today in collaboration with the CDC.
Next question is from Aaron Ross, OPB.
Hi, Melissa. I was wondering, did you go to? So you said that you haven't had a chance to look at the data from non-severe breakthrough cases. Is that right?
I have seen much of that data, but we haven't had the capacity to parse it by vaccine type.
Have you been able to parse it in terms of transmission? There's been a lot of speculation that since the CDC stopped tracking non-severe breakthrough cases, that they would have missed transmission and pretty much just got lucky with the Providence cluster. Did we see anything in Oregon's data?
That's an interesting question, Erin. So all of these vaccine breakthrough cases are treated like any other COVID-19 case, meaning that they are investigated and contact traced. I think it's important to acknowledge that case investigation and contact tracing is imperfect because not everyone picks up the phone and not everyone provides the information that we request. We've also had several local jurisdictions operating under surge capacity for some time now. So they are not always able to get to all of those cases, but they would be treated like any other case in terms of investigation.
But there hasn't been an opportunity to actually look at that data and then see if people who are vaccinated were transmitting prior to this CDC recommendation.
We haven't, for example, broken out the vaccine breakthrough cases and looked at transmission statistics, if that's what you mean.
Yeah, okay, thanks. And then that mentioning those several jurisdictions under surge capacity is hits the other question that I wanted to ask, which is knowing that there's so many counties that are getting pretty overwhelmed, and that we do know that if you do get sick while you're vaccinated, there is a decent chance that you can transmit COVID-19.
We have been clear and similar recommendations. Certainly not all of them, but we are encouraging them to do that to protect their population.
Do you speak with the leaders of those counties that have been having very high cases?
I personally have not spoken with them recently.
What did she say?
Okay, thank you.
Next question is from Jeff Landon, the News Register.
Thank you. I got a couple of questions related to the monthly breakthrough case report. The first question, there's a block of numbers for variants, and about 5 or 6 different variants with numbers. Can you tell me whether those are among the cases for the month being reported, or are those among the cumulative Oregon cases?
Information on a limited number of vaccine breakthrough cases. So essentially a sample of that population, much as we have sequencing information on a sample of the greater population. And that's why those numbers are small, because the overall vaccine breakthrough numbers are small as well.
Why does the camera keep turning
One other
itself
question
on?
is that throughout the pandemic, OHA has provided access to various databases on all kinds of information related to vaccines and COVID cases. Is there a database or some database elements that would be considered public record that would relate to breakthrough cases that might allow analysis much more easily than trying to compare the existing monthly reports.
Thanks, Jeb. To date, the vaccine breakthrough report has been a static PDF. It hasn't been a Tableau dashboard, which does facilitate downloading that data. I think that's something we can certainly consider. I'm happy to take it to our data team.
Okay, thank you.
Question from Lisa Balick at Coin.
You need to unmute me? Okay, great, thank you. Yeah, a question probably for Melissa is, the death rate from COVID, vax versus unvaccinated. In other words, there's a lot of people who are adamant against getting a vaccine, and they say that's the only number that they'll look at is how many people are dying who are unvaccinated versus vaccinated. Can you provide those numbers?
Lisa, thanks for that question. So in the vaccine breakthrough report, what we've provided is the number of COVID-19 associated deaths per month, and then the proportion of those deaths that occurred in unvaccinated individuals. We pulled that information only for the last 3 months, largely because we were waiting for enough of the population to be vaccinated that it made sense to publish that information. I believe in May, the figure was 91%. In June, it was 94%. And again, in July, it was 91%. Did I understand your question correctly, or were you looking for something else?
I think it was the actual numbers. We keep reporting percents, but the actual number of deaths. I mean, do you have those handy?
I can certainly get it to you pretty quickly. I don't have it right in front of me.
Okay, because the other follow is that can the state provide vaccination status for the daily COVID numbers? In other words, we see there's 1,000 new cases, 1,200 new cases, and there's how many of those folks are vaccinated, how many are not on the daily basis?
Lisa, I'm going to say probably not, because again, we have to do so much manual review of these cases. The information that's put into the vaccine database, it's not always in a standardized form. So while we can try to automate it, we literally have to go through every case that has a vaccine on record and see if they have in fact completed the series. It's not something we have the staff to do on a daily basis. But we are moving to report vaccine breakthrough information more frequently. So we are now going to be reporting it every other week on Thursdays.
Thank you.
Next question is from Elizabeth Hayes at the Portland Business Journal.
Hi, thanks. So I'm wondering if you're seeing any encouraging signs in vaccinations in the last couple of weeks. Is the news around all these numbers and the Delta variant possibly getting people off the fence, as you said, more?
Thanks for that question, Elizabeth. I actually haven't looked closely enough to answer that question well. I can certainly look at the last couple of weeks of data and get back to you. What I will say is that we are seeing that in other jurisdictions that are being hit even harder than we are. So I do hope that that's the case, but I'll look into the numbers and get back to you.
Thank you.
Angelina Dixon from KVAL asks if the Delta variant is part of what was reflected in the breakthrough case data reported today.
Thanks, Angelina. I do think the Delta variant is having a dramatic impact on our current situation. As we've seen Delta quickly become the dominant variant, we have headed into a very steep surge. we are seeing high case rates, a lot of hospitalizations and ICU admissions, and unfortunately, we're starting to see additional deaths. So I do think it's dramatically impacting our current numbers. If your question is about the proportion of all cases that were unvaccinated in July, that 81% figure, what I can say is we're not sure yet. So what we have seen in other countries is that vaccine effectiveness against symptomatic infection, so just getting COVID with symptoms such that you get tested, has fallen with the Delta variant. So last week, the CDC released a report from Barnstable County, Massachusetts, very high proportion of vaccine breakthrough cases. So I think there is legitimate concern that vaccine effectiveness against symptomatic infection is lower with Delta. But the important thing is that vaccine effectiveness has remained incredibly high, on par with clinical trial data against severe infection. And we have that information from several other countries. And I hope that we'll have that information in the United States within a couple of months.
Angelina has an additional just to break
of public health. They do have to have a positive test result. That's part of the vaccine breakthrough definition. So it would only include confirmed cases, not presumptive cases with symptoms and an exposure, but no test on file.
Our next question is from Genevieve Rayom at K2.
Hey, thanks. I've got two questions. You guys keep saying that, the number of breakthrough cases, when you look at the entire picture on Oregon, the number of people who are vaccinated, that it is so small. I am trying to figure out what that number actually is. So this is a math question, and I just want to make sure that I'm using the right numbers. So I'm hoping someone can verify this. But if the state has had 4,196 breakthrough cases in all, and we divide that by the number of people who are fully vaccinated, so that's 2.3 million, that comes out to 0.0018. So are we saying that 0.2% of people who are vaccinated in Oregon have had COVID or have gotten COVID in a breakthrough case?
Genevieve, it's a really good question. And we actually talk about this math a lot here at OHA. It's not completely accurate to say that because we're not certain that all vaccine breakthrough cases are coming to our attention, for example. So I think you can do that math and you can present the number that way, but it is important to understand the limitations of the numbers we have.
Okay. And then the next question I had is in regards to the ruling that OHA is going to issue today. I don't know if there's someone here who can answer this or not, but we have some questions about patient rights. So what rights do patients have? If they're going to a healthcare facility, do healthcare workers have to obviously state whether or not they're vaccinated? Can a patient request someone who is vaccinated?
Genevieve, I didn't catch the beginning of the question, what's being issued today, which makes me think that I might not be appropriate to speak on this.
Okay, yeah, and there might not be somebody here, but we're just curious about the ruling that OHA is going to issue today about healthcare workers having to get the vaccine or be tested.
They already
We were
issued
just
that.
wondering if there's a ripple effect for some patient rights there that will be included in this ruling. Can patients ask if their healthcare provider is vaccinated?
I'm not able to speak to that. I'm not sure if Dr. Niskanen or Dr. Turngren have any additional information.
What I have heard is that, of course, they have the right to ask. The real challenge or question is the healthcare worker obligated to answer? And that becomes a sort of a HIPAA, a privacy issue. So I think it's an open question more than an answered one, is what I have heard. I do know that I heard last night in a statewide chief medical officer meeting that the employees at Providence are going to have, at Providence hospitals in Portland, are going to have stickers on their ID badges indicating their vaccine status. That's obviously, all these things can get a little on the controversial side. That is something that I think other systems have discussed. We are not doing that at Samaritan. That's a little more information on this. I think that, however, what I do believe is that patients should expect the safest environment possible when they go to a healthcare provider, whether it be a clinic or a hospital. And the higher percentage of our employees who are vaccinated, the safer the environment, almost by definition.
At Sky Lakes, it's an interesting question. I've never actually had a patient ask me personally, am I vaccinated? But all our identification badges, since we started vaccinations back in December, we actually have a sticker that is on both sides of our badges that show that we've been vaccinated.
Our vaccination rate, just some interesting numbers, our vaccination rate amongst our employees system-wide is 80%. It's higher in Benton and Lincoln County than our facilities in Lynn County. And amongst our employed physicians, 98% of our employed physicians are vaccinated. And we have about 400.
Becky's back on mute, but she says thank you for those answers. Looks like that's all the reporters who are asking their first questions. I understand Amy Green from the Oregonian has a follow-up. Amy?
Thank you. I have a few questions. I'll just fire away. Dr. Sutton, can you tell me how many of the unvaccinated people who were sickened in July are children 11 and under?
I can't right now, but I can get that number to you this afternoon.
Yeah, that would be great, because I feel like a lot of people are saying, oh, it's the unvaccinated people who are getting sick and it's their fault. But I think it's good to keep in mind that some are not able to get vaccinated.
I think that's a great point, Amy. Thank you.
Mm-hmm. Thank you. Do you have county by county percentages of the breakthrough cases for July? There are numbers included in the report, but I would be interested in just looking at July. I mean, were there any counties that had 30% breakthrough cases and some had 10? Are you able to provide that information?
I think it's a good idea. We just added the county-specific data to this most recent report, and I will talk to my team about adding that to the report in 2 weeks.
Okay, great. Thank you. Also, the average age of infection of non-breakthrough cases, we know that it's 51 for the breakthroughs. Same question with deaths. It's 83 is the average age of death for the breakthroughs. How about, can we compare that to the non-breakthrough cases?
Again, I can definitely get those numbers to you. I don't have them in front of me. I think it's a really interesting question.
Yeah, thank you. Okay, I appreciate that. And then last question. How worried, can you speak to how worried a person who's fully vaccinated should be upon hearing that about 1 in 5 of these cases, COVID cases in Oregon last month were breakthrough cases? Is the key here that vaccinated people should feel much more secure, but with 19% of the cases, they should be cautious. They should feel cautious about going indoors and spending large amounts of time with people who they don't know their vaccination status. Please speak to that.
Yes, I mean, thanks again. Another really good question. I mean, how worried should people be? I would say there's an incredible amount of disease in the community right now. If you are vaccinated, you are well protected, but the vaccines are not perfect. You're extremely well protected when it comes to severe disease. And so I would say, I think you should be taking precautions. I personally mask when I go into indoor spaces. Certainly when I'm around crowds, even outdoors right now, I just think the risk is out there in the community. I sleep better at night knowing that I'm vaccinated and knowing that I'm so unlikely to end up in the hospital. But I do think people should take precautions. Everyone.
Thank you very much.
Well, time for one last question from Aaron Ross of OPB.
Thank you. My last question is, so you haven't been able to speak with the leaders in those counties that have been having big surges, but if you could, what would you recommend to them? I mean, obviously there's the statewide recommendation, but in terms of actions that leaders can take, what should they take to slow the spread in that area and to protect unvaccinated people like children?
Yeah, I think, working with stakeholders right now to encourage whatever we can do to reduce risk is really important. Working with businesses and communities, working with healthcare systems to make sure that there is a change in thinking and in behavior. I think at this point in the pandemic, that's really what we can do. I'm not sure what else to add.
Do you think that there's any appetite for, do you think if a county were to issue a mask mandate, is there any appetite for that? Do you think it would go over well, or does it sound like that's kind of off the table now?
It's a great question. I think every county is different, and there are likely counties where I think that sort of mandate would be respected. I think there are counties where that might be quite unpopular. We have really come to a point in the pandemic where we are looking to local jurisdictions to make decisions that are best for the populations they include.
Thank you.
And certainly every county can work to encourage residents to get vaccinated. Okay, well, I want to thank our speakers today and thank you all for joining us. We'll continue to hold these briefings and we anticipate potentially another briefing next week. So thank you again,
and that was the end of that, and he wasn't done his sentence.
And we anticipate potentially another briefing next week. So thank you again, and
all right, let me play the beginning that I didn't hear.
Dr. Niskanen and Dr. Turngren will tell us how young Dr. Niskanen and Dr. Turngren will tell us how younger and sicker people are filling beds at Sky Lakes and other hospitals, and how this dire trend affects every person in Oregon needing hospital care. Our message today is simple and direct. COVID-19 vaccines save lives. The COVID-19 vaccines are safe and effective. They are the silver bullet that will end this pandemic if we can vaccinate as many people as possible. Now let's look at the major new research that was released today by the CDC. The CDC's COVID-19 hospitalization surveillance system tracks severe COVID-19 cases in Oregon and 13 other states. It found that among more than 7,000 patients aged 65 and older from February through April of this year, the Pfizer and Moderna vaccines were 91 to 96% effective in reducing the risk of hospitalization. And the J&J vaccine was 84 to 85% effective in reducing the risk of hospitalization. These data confirm the findings of earlier clinical vaccine trials that revealed a dramatically lower risk of hospitalization from COVID-19 among vaccinated people. These findings are important for several reasons. First, they demonstrate that COVID-19 vaccines are working as well in the real world as they did under clinical trial conditions at preventing severe COVID-19. Second, there was no evidence of decreasing effectiveness over time. And third, they demonstrate that COVID-19 vaccines work exceptionally well in elderly adults, and we believe they will work as well or better in younger people. These findings and our experience with COVID-19 here in Oregon reaffirm that all three available vaccines are extremely effective shields against hospitalization and death from COVID-19. While these data were collected before the Delta variant became the dominant variant in Oregon, we are confident that these estimates will remain very high even as the Delta variant circulates. We believe this because we have vaccine effectiveness data from several other countries demonstrating very high protection against hospitalization and death from the Delta variant. Let me provide some key takeaways from July's COVID-19 vaccine breakthrough report, which was released yesterday. Oregon has identified 4,196 vaccine breakthrough cases to date. The number of vaccine breakthrough cases remains very small when compared to the more than 2.3 million Oregonians who have completed their COVID-19 vaccination series. Overall, there were 12,541 cases of COVID-19 reported during the month of July, and 81% of these occurred in unvaccinated people. The proportion of vaccine breakthrough cases is expected to increase as transmission increases in the community and more people are vaccinated, and does not mean that vaccines are working less effectively. Of the 55 COVID-19 associated deaths reported in July, 91% were among people who were unvaccinated.
Wait a minute. She just said it was 81, and then she said it was 91.
And now I'd like to show a slide that 19 associated deaths reported in July, 91% were among people who were unvaccinated.
Yeah, thank you. Hold on a second. This is the replay, and something she just said doesn't add up. Hi, Mike. The vaccine is working, but the Delta virus is very, let me see. The vaccine is working, but people who are vaccinated can get the Delta virus, and they can also spread the Delta virus because it's highly transmissible. So, but the number she just gave if 19% of the breakthrough cases, they said 19% of the breakthrough of the cases in Oregon in July were breakthrough cases. And of those 19%, 7% within 2 weeks ended up hospitalized. But then she said 91% in July are unvaccinated, but that doesn't add up. The number would be 81%. That's the part I was replaying. But no, many are not dying that have been vaccinated, but enough people, it's not many based on the number of vaccinations, but it's a high enough percentage that it's concerning me. If 19% of the cases in Oregon in July were breakthrough cases, and if those 19%, 7% of those people within 2 weeks ended up hospitalized, and some breakthrough cases do die, I'm in a high risk group, and even though I'm fully vaccinated, I don't necessarily feel safe right now. And I almost wonder if I should stay home or use my respirator, which the respirator is more effective than double masking with an N95 or a KN95 plus a surgical mask. But yeah, it's getting bad. But they also said that with the Delta variant starting to shake again, it's probably anxiety. With the Delta variant, there's more transmission, and with more people getting vaccinated, there's going to be more breakthrough cases. But most of the people getting breakthrough cases are being protected by the vaccine to where they're having few symptoms. But does that mean they won't get long haul COVID? I haven't heard an answer to that question. And the less people that the reason the vaccines are protective is that if they don't get enough people vaccinated, the virus will keep mutating and having variants until they get one that totally evades the vaccine's protections. So that means the US not only needs more people vaccinated, but needs to help the world get vaccinated, because otherwise there's going to be one of those mutations and variants happening somewhere else that's going to be brought into the US. And you would recommend, okay, before, let me see if I can not trigger a migraine and make sure I read all your comments. You'd recommend that I stay home. And long haul COVID is bad. Memory loss, hair loss. Yeah, the answer of whether people that are getting few symptoms are still, can they still get long haul COVID? Again, I haven't heard an answer to that. Delta plus, Lambda variants. I have to look up the information on the Lambda variant. Let me play that part that she just said again and see if she made a mistake with her data.
Vaccinated, and does not mean that vaccines are working less effectively.
Yeah, should I play that sentence she said? Because it answers one of the things you just said.
The proportion of vaccine breakthrough cases is expected to increase as transmission increases in the community and more people are vaccinated, and does not mean that vaccines are working less effectively. Of the 55 COVID-19 associated deaths reported in July, 91% were among people who were unvaccinated.
Now, that's the number? She said 91%, but was that in Oregon? Because she just, the number that came out is not 91%, it's 81%.
Of the 55 COVID-19 associated deaths reported in July,
oh, the deaths.
91% were among people who were unvaccinated.
Okay.
And now I'd like to show a slide that further illustrates how vaccination is protecting people in Oregon from COVID-19 infection. This is a graph of the rate of new infections per 100,000 people in Oregon per week in vaccinated and unvaccinated individuals.
Let me show you this slide.
The current rate for vaccinated individuals is less than 50 per 100,000 people per week. The rate for unvaccinated people is more than 6-fold higher. Vaccination remains the best way to protect yourself against COVID-19.
Where are you located? What state? And I'm replaying that one part.
It's more than 6-fold higher.
6-fold of what?
1,000 people per week. The rate for unvaccinated people is more than 6
Here in Florida?
higher. Vaccination remains the best way to protect yourself against COVID-19.
Florida is not doing well right
less
now.
than 50 per 100,000 people per week. The rate for unvaccinated people is more than 6-fold higher.
What? See, that's where my ADD is kicking in, and I don't understand what she's saying.
Is less than 50 per 100.
Let me hear the beginning of that sentence.
The current rate for vaccinated individuals is less than 50 per 100,000
Portland, Oregon.
people per week. The rate for unvaccinated people
is
more than 6-fold higher.
Okay, I'm gonna pause this for a second because this just ended, and I was playing the part that I didn't hear, but I don't like these charts. These charts
less than 50
sorry.
per 100,000 people per 1,000 people in Oregon.
See, yeah, thank you. This was in Oregon. This was based on the Oregon numbers. And it's on KGW, like on Facebook, if you want to see the whole video of the people talking. But like, let's see if, I don't even know how much of this I have left that I hadn't heard, but
per week in vaccinated and unvaccinated individuals.
You too, be safe.
The current rate for vaccinated individuals is less than 50 per 100,000 people per week. The rate for unvaccinated people is more than 6-fold higher. Vaccination remains the best way to protect yourself against COVID-19 and to keep the virus
Let's
from
see
spreading.
that slide again. That was interesting. That slide is showing that the curve that's going way up is only going up a little
Vaccination
with the
remains
vaccinated.
the best way to protect yourself against COVID-19 and to keep the virus from spreading among our loved ones, our friends and neighbors, and our communities. Now let me speak briefly to the rapid spread of the Delta variant here in Oregon. We now estimate the Delta variant accounts for more than 80% of all new COVID-19 cases. It is now the dominant variant circulating in Oregon and nationwide. It is 2 to 3 times more infectious than early COVID-19 variants. For unvaccinated individuals, the risk of COVID-19 has literally never been greater. We urge all people in Oregon who can be vaccinated to do so and to protect those who cannot, such as children under 12, by masking indoors, distancing, and avoiding gatherings. Vaccines are saving lives in Oregon every day. Please take the opportunity to get vaccinated. And now let me turn it over to Dr. Niskanen to discuss the impacts of this latest surge.
All right, I heard the rest of this. Hello to the 13 people. If you want to listen to the audio, you can replay my broadcast. It started about 5 or 10 minutes. Like, I missed the beginning and I listened to the beginning at the end of my broadcast. If you want to listen to the audio, you can listen to my replay. If you want to see the video of the people speaking, you can go to KGW's YouTube page, KGW News Channel 8 out of Portland, Oregon. It's on their YouTube page. It's also on their Facebook page. It's also on the OHA, what is this? It was on the KGW page also, okay? I'm going to turn this off because I'm going to turn on the Olympic coverage, and that gets flagged on my Facebook really quickly as copyright, as like owned by the Olympics, and I don't want my Facebook limited again. All right, bye everybody. Thanks for listening with me, and stay safe. Wear a mask indoors, or if you're near anyone that you're not normally around outdoors, okay? And wear a KN95 if possible, or an N95. All right, bye. Wait, you might need the boost. Okay, the booster's not being offered yet. Even the booster being offered in Israel is not being offered to people my age. Provincetown outbreak, yes, 70% were vaccinated. All right. So regardless if there's a mask mandate where you are or not, wear a mask, okay? You can even catch this outdoors, so wear a mask.